What happens to the brain when somebody hallucinates? Very interestingly, on fMRI studies, it shows that the same parts of the brain are activated. Let's say if we're talking about hearing or auditory hallucinations. So like right now you can hear me. The same parts of your brain will be activated on the fMRI as when you're hearing somebody in real life. So imagine, even though voices aren't real, yet your brain is registering them to be absolutely real. The reason why hallucinations occur are due to increased dopamine levels in our brain. Dopamine is a chemical very good for motivation, for our drives. However, excess of anything is bad. I keep saying that on my channel all the time. And excessive dopamine can cause psychosis and can cause hallucinations very commonly. The first time that a patient hallucinated in front of me, or the first time that I was seeing a patient hallucinate, was in my first year of MD training, and I was sitting across a patient who I was interviewing, and we were doing something called the mental status examination, and this patient kept looking behind me into the empty space, and it was just the two of us, and this patient kept replying to a series of questions which I wasn't even asking, and they were sort of like dialogues in retaliation to some questions or something being said. On inquiry, I asked him that, who are you speaking with? And he commented that they are following me and they're telling me what to do. To which I said that, what are they saying? And he said they're talking about me in third person and they're calling me all these bad derogatory names. Now, third person hallucinations or running commentary hallucinations are extremely common in schizophrenia or psychosis. What was my reaction to the very first time that a patient hallucinated in front of me? Was I scared? Now, full cards on the table, I was a little bit perplexed. After which I was intrigued, and finally I realized that this is something I've been reading in the book and I'm finally seeing, and it all made sense. I was able to deal with it very empathetically and calm this young gentleman down and tell him, without challenging his belief system immediately, that, oh, there's nobody there. That's a very wrong thing to do right away, trying to thwart somebody's belief even though he believes he can actually hear all these voices. And so definitely dealing with them sensitively is a very important tip that we learn.